We're joined right now by U.S. Senator George LeMieux, recently appointed to replace Senator Mel Martinez in the state of Florida. Thanks so much for joining us, Senator.
I'm happy to be here.
You were among 39 Republican senators who voted against debating the health care bill. Just talk to us about why you chose to vote that way.
Well, it's not just against debating the health care bill. This is a vote forward on the substance of the bill. As you know, now that this bill has been put forward, it'll take 60 votes to change anything in the bill. And this bill cuts Medicare by $500 billion. It's going to increase Medicaid costs for the states, which is going to be at the expense of teachers and law enforcement. And it's going to raise taxes by $500 billion while not doing anything to lower the cost of health care for those Americans who already have insurance. So I don't think it's a good start. I think we should start over and take a step-by-step approach.
Now, two Democrats who were critical in moving the debate to the Senate floor indicate they won't support a health bill with a government-run insurance program. And the split is widening for Democrats. Is this an indication that lawmakers are indeed either uncomfortable with the bill in its present form, or are they indeed listening to the American people and their voices and the dissent from the town hall meetings and the protests?
Well, they're trying to have it both ways, but make no mistake, they have voted for the bill already. They can try to say, look, I'm not voting for the bill, I don't like this particular part, but again, it'll take 60 votes to take the public option or anything else out of this bill. So I don't know if they're listening to the American people. If they were listening to the American people, I don't think they would have voted for the bill.
Now, there's talk that if Democrats don't seal a deal by the Christmas break, that health care reform may lose momentum, never pass, and die in Congress. Do you think that's realistic?
I hope not. We need health care reform. We've got 40-some million Americans without health insurance. Health costs have gone up 130% in 10 years. We need real reform, but we don't need bigger government. We don't need more taxes. We don't need cuts to Medicare.
Now, the nonpartisan CBO says the government never before has made the American people purchase a product. Do you feel that this is unconstitutional? And if it does indeed become law, can we expect a challenge in the courts?
I think there will be a challenge in the courts. I haven't evaluated whether or not it's unconstitutional, but it does strike me that in our system where government comes from the consent of the government, that we're now in a situation where the government cares more about me as a person than I do and is going to make me buy health insurance for myself, and the IRS is going to collect a tax on me if I don't buy it. It seems a little amiss to me.
Unemployment numbers continue to rise, and it seems, whether perception or reality, that job creation has taken a back seat. Obama's in a pickle because he can't get Congress to concentrate on anything else. Is this going to be detrimental to Democrats, do you feel?
Well, look, we are doing health care, this package, which I wouldn't call reform. We're doing this now because the Democrats and the administration want to do it now. We could be focusing on creating jobs. We could be trying to return money to small businesses to let them hire new people instead of putting new burdens on them like this health care bill, which may actually result in losing jobs. So the focus of what we should work on or not is up to the president and the administration. Right now, we're not working on jobs. I wish we were. More than 11% unemployment in Florida, the worst it's been in anybody's memory. That's what we should be focusing on, is jobs and jobs and jobs.
An attorney for one of the 9/11 terrorists says the men who are to be tried in civilian court are expected to plead guilty and plan to use the trial as a venue with which to spout their anti-American propaganda and their opinions on U.S. foreign policy. What's your reaction to that?
I'm outraged about the trying of Khalid Sheikh Mohammed and the other 9/11 terrorists in a civilian court in New York. It makes absolutely no sense. And we should know better. We have used military tribunals to try enemy combatants since the time of George Washington. Franklin Delano Roosevelt did it. We did it for the driver of Osama bin Laden. It works, and it's what's right. These are not American citizens. They are foreign combatants. And the fact that we are going to haul them up to New York and try them in a civilian court where they're going to get discovery from us. We know from the 1993 bombings on the World Trade Center, when we did those trials, important information about how we track terrorists got back to the terrorists, because in the trials that we have that are in civilian court, they get to learn information. And the bad guys, the terrorists, changed their tactics because they found out that we were onto them. That might have put us in jeopardy for 9/11. Why we would do this, I have no idea. And now you see, instead of pleading guilty, which is what they were going to do in the military tribunal, they're going to plead not guilty and use our court system to create an international reality show for their propaganda.
Can we expect more from Senator LeMieux in years to come? Will you run for election when the time comes?
Well, we'll see. I'm focused on doing this job. I feel very fortunate and honored to be in the United States Senate at such a critical time. You know, we're at a time like really no other. We're in the worst economic situation since the Great Depression. We're fighting a war on two fronts, and now we're talking about, federalizing 1/6 of American economy in the healthcare business. So I feel I'm there at a very important time, and I'm going to try to make the most of it.
Senator LeMieux, thank you.
Thanks so much.